Inovio Pharmaceuticals reported its phase 2 results for its COVID-19 vaccine candidate, INO 4800, earlier this week. Brian, what were the highlights from Inovio's results? And do you think this might be a case of the biotech simply being too little and too late to make a difference in the COVID vaccine race?
Yeah, so the phase 2 trial was measuring antibodies. They're not measuring the efficacy of whether it protects people against COVID-19. That wasn't the purpose of the phase 2 part of the trial. So it did produce antibodies, and it produced more antibodies, a higher level of antibodies in the higher dose than in the lower dose. So that's exactly what you would expect. The same thing for T cells, produce more T cells in the higher dose than the lower dose. On the safety side, I noticed the side effects the company noted that the side effects weren't worse for the second dose than the first dose. So that's kind of actually interesting and could potentially maybe give it an advantage over Pfizer and Moderna that seem to have a pretty strong side effects on the second dose, at least mild, but a lot of people have them. They're planning on taking the higher dose into the phase 3. Unfortunately, the company didn't give any updates on its plans for how it plans to carry out the phase 3. I'll stop short of saying too little, too late, but maybe it was too little data, certainly not enough to gain approval. Whether they're too late, it sort of depends on whether Inovio can figure out how to run a phase 3. They need to find a region that doesn't have access to vaccines to run and a fairly high rate of COVID-19 to run the phase 3 clinical trial. And then if they do that, then the question is, will the FDA accept the vaccine for authorization or maybe even full approval if they're running a clinical trial outside the United States? So those are questions that investors in Inovio still need to figure out in trying to value the company, is how can they run the phase 3? And then if they can run the phase 3, can they get authorization or approval in the United States?
Yeah, and you and I have talked before about Inovio and some of the other vaccine makers that aren't in the lead positions, that they may have an easier time getting authorizations and marketing their vaccines outside of the US.
Yeah, and I don't know if that's going to be the inevitable thing for Inovio. I mean, it's kind of interesting because I don't think like that if you develop a new flu vaccine, I'm not sure that you have to show efficacy or whether you just have to show antibodies. So maybe at some point when we're getting to the point where we're no longer in a pandemic, maybe companies can develop coronavirus vaccines based solely on the ability to create antibodies.
I think you could very well be right. It might be at least another year or so before we get to that point, but it wouldn't surprise me that something happens exactly along the lines of what you're saying.